Hi, I'm Christina Cusimano, Senior Vice President of Marketing here at AGS Health, and today I have the privilege of sitting here with Thomas Thatapudi, our Chief Information Officer, to talk about agentic automation and the future of revenue cycle management. Thank you, Thomas, for joining us today. To begin, could you explain in simple terms what agentic automation means, especially in the context of healthcare RCM? Like, what are the key characteristics that differentiate it from traditional automation?
It's a pleasure being here with you, Christina. This is a very exciting question for me personally because automation has been around for a while, as most of our customers know. This is not a new thing, but what is the pivot here is that a lot of the automation in the past has been what is typically called as robotic process automation. It is essentially the fact that some of the simpler activities which do not require judgment, are very simple and rules driven, can be automated, which means that you can write a few lines of code which mimic those simple actions, and so therefore there's a robot doing it. And the more complex parts or the more complex activities of revenue cycle management would go down to the humans. What makes agentic automation that much more exciting, and what I believe is at a pivot point, is because agentic automation is also supposed to mimic human logic and human judgment. In our daily lives, most of us are most probably interacting with ChatGPT or Claude or any of the other large language models, and we can talk to them, we can ask them to make vacation plans for us, we can ask them to write an email to a boss, right? Or to send an angry email because a claim got rejected or whatever, right? And ChatGPT responds to us just like you have a very educated, a very seasoned persona replying to that particular thing, right? And so agentic automation is exciting because it's going now into the realm of mimicking human judgment, and so therefore some of the more complex activities that the humans are doing can now be done much more effectively with better accuracy and hopefully less expensive, and so therefore we are able to get better quality at a great price that we can then pass on back to the customers.
How can agentic automation specifically be applied to various stages within the healthcare revenue cycle management process? Could you provide some concrete examples of its application?
As you can imagine, agentic automation is a newer frontier of technology that we're exploring. There are multiple use cases being developed right now as we speak, and because it's a new frontier, there are new use cases that are being uncovered almost on a weekly basis right now. But just to give you a perspective on some of the things that we're doing right now, for example, in accounts receivable, what we do right now is we have a model, a machine learning model that tells us a particular account needs to be sent to a more tenured agent as against a less tenured agent because of the complexity, because of the dollar amount, right? We're making some intelligent decisions on making sure that the right account goes to the right person at the right time. For example, if we have to make a call to a payer, we're building out agentic AI where there's an agent. When I say agent, I mean an AI agent, which is making a call to the payer. And we know that the payers would love to have the hold time as long as possible. And so this AI agent is navigating the IVR, inputting all the right information like claim ID and others, listening to Mozart and Bach for like 35 minutes while it's on the hold time. And then when a warm voice picks up on the other side, then it calls our agent and hands off the call, right? So that's one example. And if it's a simple AR follow-up call, I just need to know if an account has been pending or denied, and if it's been pended or denied, what is the reason? And if it's a simple enough call and the dollar amount is low enough, we plan to deploy agents. When I say agent, again, I mean AI agents that can actually talk to the payers on the other side and get the required answer that then we can put it back in the EHR, right? So there are multiple use cases that we're exploring on a weekly basis. Our operations teams, our solutions teams, our transformation teams, everyone's excited about the possibilities. And we hypothesize and we're taking big bets on it as we speak, is that in the next 12 to 36 months, we will transform quite a bit of the work that we do and infuse a lot more AI and more specifically agentic AI into it.
Many healthcare leaders are likely familiar with basic robotic process automation, RPA. So how does agentic automation represent an evolution beyond RPA in terms of capabilities and impact on revenue cycle operations?
That is correct. A lot of healthcare leaders have dealt with robotic process automation over the last 15 years. They have either implemented it themselves, worked with vendors to build solutions, or even worked with providers like us to see what are the opportunities, right? But robotic process automation has been limited in its scope, right? It picks a particular point statement or a problem. For example, if you have a workflow which has got like 10 steps, somebody's looking at it and saying step number 2 and step number 5 can be automated because they don't involve any judgment and it's all rule-based, and so that's where we'll build the bots, right? And so it's worked, no two things about it. They've made good money, it's given productivity, it's given good quality, but that kind of automation usually is not repeatable and scalable, and so these are point solutions which are kind of in there, between those walls, right? And so the pivot that the healthcare leaders should be looking at right now is that the services that are being rendered, right, whether it's humans doing it in-house within the provider's walls, or it is they're talking to an offshore vendor, outsourcing partner, they have humans doing a portion of this work. And these work components are usually complex, they require judgment, they require somebody to be acutely aware of the standard operating procedures, they need to be aware of nuances that they take, exception paths that they take. So there are multiple things where there is institutional knowledge with these humans, right? Now, the next frontier for robotic process automation, as I was talking about, is can agents, when I say agents, I mean AI agents, can they mimic the humans and can they do some of these complex parts, right? And so therefore what the provider should be looking at is, can I do the work faster? Can I do them with much shorter turnaround time? Can I do them with better quality, right? Can I use them to make judgments that are usually a little more difficult, right? And so there are multiple opportunities for the healthcare providers to question the existing paradigm of I'm going to buy software from Epic and I'm going to buy services from AGS Health. It could, or I'm going to bring in FinThrive to bring in analytics. Now you have the ability to question and say, all right, I don't want to look at it in 3 different parameters. I need the same entity to tell me what the analytics on it is, and so therefore what is the next best action that I need to take on it, and can an agent and an AI agent take an action based on that what the analytics dashboard is telling you, and so can it all happen within an agentic AI as against a human looking at a dashboard, talking to his or her manager to make a call, and then doing all this, right? So now you can see that the paradigm is going to change. For example, if I can just take it related to the real world, if somebody's making I'm doing it right now as you speak, right? I do want to take a vacation. I think it's, so it's long due for me. And I'm using ChatGPT to make my plan, right? So the initial plan was that we were going to not take our kids. And then something dropped off. Now we're taking our kids. Now I got to redo my plan because I have 2 girls who were, bubbling with energy, and I need to occupy them, right? So now I went back to ChatGPT and said, "Hey, can you redo the plan? Can you give me a much more family-friendly resort? Can you change day 3 to include more water sports, right? They want to do kayaking and they want to go snorkeling, right? So I got to include all that in the activities, right? So now instead of me talking to a travel agent and the travel agent like going back and forth with me on an email, I can do this in the next 60 seconds using ChatGPT, wow. Right? And so those are the same kind of analogies that we will see happening here, right? So there is an account that is pending, There is a standard operating procedure behind how you do it because it's an exception, right? And now you're either waiting for a manager or a more tenured resource to tell you, or maybe at AGS Health, we are trying to send it back to the customer because it's an exception. But instead of all that, we are letting an AI agent take a call on it and say, I'm taking this call and the call is this. You could certainly have it audited at some point in time, but those are some of the paradigms that will start to break and different paradigms emerge as we see the evolution of agentic AI in the next 2 to 4 years.
So next question. What are the key benefits that healthcare organizations can expect to see when implementing agentic automation in their revenue cycle, both in terms of financial outcomes and operational improvements?
That's a great question, actually, right? Because we need to keep this in mind, especially we at AGS Health, we are always wrangling with that, right? You could use the most fantastic buzzwords out in the market, agentic AI, large language models, generative AI, DeepSeek. All these things don't matter at the end of the day if you're not delivering value to the customer, right? In our case, the providers, we know that they're having to struggle with razor thin margins in some instances. The payers always pushing back in terms of prior auths and denials. There's more regulatory aspects that come into play, right? So there is something or the other which is always impacting these margins, right? And so at the end of the day, what matters to our customer is, are they able to operate with best-in-class margins so that they can do what they do best, which is deliver clinical care to their patients, right? And so as long as we are able to help them do their work, but ensure that their financial viability is done, is rendered or is delivered to them, and so they have better quality, they have faster turnaround times, they have faster collections, they're collecting money that they typically don't collect and goes to denials, right? When we do the coding, we are able to capture the right code so that we can do the right billing, right? And so we are ensuring that our customers are able to operate their systems with the right financial health, right? And if we can do all of that, right, and we are using technology and AI to deliver that, that's the value there, right? So if I come to the customer and say, I'm using AI to do your denial management, but by the way, the denial management is has gone down, our success rate has gone down by 50%. Oops, it doesn't matter, right? Like, so we have to be careful about what we bring to the table. We could bring all the buzzwords, the right technologies, the right investments, but at the end of the day, they have to translate into financial outcomes for our customers, which is faster collection rates, better quality in whether we're doing prior authorization or medical coding, right? And so whatever we do, right, all our innovation path, whatever use cases we pick, we are always very careful to curate them and, more importantly, tie them back to financial outcomes for our customers so that when the bet pays off, we know that we are adding value to ourselves and our investors, but at the same time, more importantly, we're bringing value to our customers.
So for healthcare organizations that are just beginning to explore the potential of agentic automation, what would your advice be on how can they get started and what initial steps should they take?
That's a really good question, right? Because a lot of times there is energy behind these ideas, and you feel like somebody's doing something, so I have to start doing something, right? So two things that I would recommend. One is a lot of these agentic AI and the lot of AI that is coming in is data dependent. And we do know that data is in silos, right? It's inside an electronic health record. It's inside another tertiary system. It's inside a billing system, right? And it's with all your service providers who are giving you services, right? It's an analytics dashboard, which is accessed by only a small portion of your people, right? So data is siloed. It doesn't talk to each other. The data is not what I would call as being AI ready, right? So it's not commingled together. There is no data governance. the data doesn't render itself to being AI ready, right? So one of the things that I recommend is that we know that the data is right there, but it is not commingled, it is not talking to each other, there is not like a data set that is AI ready, right? So what my recommendation would be to especially revenue cycle management leaders is, we know that when a patient comes into a clinical care setting, we have data about the customer, right from their scheduling to prior auth to when we do the medical coding. Maybe we're doing clinical documentation integrity, where we're adding more notes to the clinical file, right, and then converting them into codes. We know that we are submitting those invoices to the payers. We know we're doing the follow-up. We know how long that follow-up has taken. We know how many touches have taken place. We know if it's a denial, we know if it's a clinical denial, non-clinical denial, right? And so we have all this data, and this data sometimes, again, like I said, is with other providers who are most probably giving you some of these services, is in a analytics dashboard somewhere, is inside an electronic health record, right? So can we put those data assets together, and can we make that data AI ready, right? Once we have the data AI ready, that is a great jumping off point, because now you can explore, can I predict denials in advance, and can I have an AI agent do my clinical denial, right? Can I predict if my prior auth is going to get denied, and so therefore can I have an AI agent make sure that the documentation is done well, right? When we do the medical coding, we know that we can code a chart autonomously within like 12 hours, right? So we know all these things. And so once we have the data AI ready, there are multiple jumping off points where we can pick all these use cases. And again, one of the things that I definitely put guardrails around myself, and I put my customers also in those guardrails, is it's very technology and AI, it's very easy to overpromise and underdeliver, and making the stakeholders, especially the CFOs of hospital systems, very skeptical, right? We have heard these stories multiple times, and so we are skeptical, and we'd like to see somebody else try it. So I want to make sure that we don't burn out our customers by throwing all these buzzwords. And so having the data AI ready, picking use cases that make sense, and making sure that we have shorter innovation paths. If an idea doesn't work, you have the humility to say it doesn't work, drop it, go to the next one and see what works. And the second one is always make sure that there is an ROI behind it, because without an ROI for the customer, it doesn't matter what technology or what solutions we bring to the table.
Well, thank you, Thomas, for joining us today. That was so insightful, very exciting, the future ahead, and really appreciate your time today.
Thank you for the opportunity, and it's a very exciting path to be on, and more things to come.